For millions of seniors dealing with arthritis, handling daily pain is already difficult. Morning stiffness, swollen joints, and that constant ache after a short walk or a few minutes spent gardening are more than just uncomfortable. They can be draining. Many older adults do everything right. They take their prescribed medicines, follow a gentle exercise routine, and even adjust their diets to reduce inflammation. But what if, despite all their efforts, something that seems helpful is actually making their arthritis worse? One often missed cause of worsening arthritis symptoms is drug interaction. Not every pill or supplement taken works alone. When combined, especially in seniors taking several prescriptions or over-the-counter drugs, some medications can interact in ways that quietly but strongly worsen joint inflammation, stiffness, or swelling. Sometimes the medication for another condition, such as blood pressure, cholesterol, or acid reflux, can reduce the effectiveness of arthritis treatments or even cause new flare-ups. This matters most for older adults who usually manage multiple chronic conditions. For example, a senior might take a common cholesterol drug called a statin, a non-steroidal anti-inflammatory for joint pain, and a daily antacid. All without knowing this mix might make managing their joint pain harder, not easier. In this video, we'll look at 6 common drug interactions linked to increased arthritis symptoms. These are combinations that often go unnoticed, especially when they involve everyday medications or supplements that seem safe on their own. For each interaction, we'll explain how it happens, why it's important, and what you can do to stay safe. You'll also hear real stories from seniors around the country who found out about these issues the hard way and how they improved their situation by asking the right questions and working closely with their doctors and pharmacists. Because when it comes to arthritis, knowing more helps a lot. Sometimes relief starts by taking a closer look at what's in your medicine cabinet. Number 1, corticosteroids and antacids, a daily combination that quietly weakens joints. Many seniors with chronic arthritis use corticosteroids like prednisone for quick relief from severe inflammation, especially during flare-ups. These drugs are strong tools in joint pain control, calming the immune system and reducing swelling that can harm joints over time. But what is less talked about is how corticosteroids, when combined with certain antacids or acid blockers, can interfere with nutrient absorption and speed up joint damage in subtle, gradual ways. Corticosteroids affect calcium metabolism and lower the body's ability to absorb vitamin D, both crucial for strong bones and joints. To help with this, many seniors are told to take calcium and vitamin D supplements while using steroids. But here's the complication. Frequent use of antacids, including proton pump inhibitors like omeprazole or H2 blockers like ranitidine, can further reduce absorption of these important nutrients. When both types of drugs are used together, especially for long periods, bones and joints can become weaker, develop small fractures, and suffer more inflammation. Florence Flo Daniels was an 82-year-old retired librarian from Sacramento, California. She had been using low-dose prednisone for years to manage her rheumatoid arthritis, especially during the colder months. Due to occasional heartburn and indigestion, her doctor also prescribed a proton pump inhibitor. At first, the combination didn't raise any concerns, but over time, Flo started feeling more tired in her legs. She developed a nagging pain in her lower back and noticed her posture slipping, which started to affect her balance. Blood tests later showed that her calcium and vitamin D levels were low. Early signs of bone thinning had started to show up as well. Even though her arthritis symptoms were under control, her bones were being affected in ways she hadn't noticed. Her doctor explained that the long-term use of both steroids and acid-reducing medication was making it harder for her body to absorb the nutrients her bones and joints needed. Flo's treatment plan was updated, her reflux medication was changed, and her doctor encouraged her to get more vitamin D through food and time in the sun. She also added more weight-bearing exercises to her routine, ones that wouldn't aggravate her arthritis. Gradually, her strength and balance began to improve. Flo's situation isn't unusual. Many older adults take both corticosteroids and acid blockers without knowing how this can affect their bone health over time. While each medication serves a purpose, one reduces inflammation, the other helps with digestion, the combination can lead to nutrient deficiencies that quietly weaken bones and worsen arthritis symptoms. For anyone taking these kinds of medications long term, it's a good idea to talk with your doctor about bone health. Nutrient testing, bone density checks, and a few small changes to your diet or medication plan can make a real difference. It's easier to protect your joints and bones early on than to deal with the consequences later. Number 2, NSAIDs and blood pressure medications, a hidden conflict that raises inflammation. One of the most common but unnoticed drug interactions for seniors with arthritis happens between NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen or naproxen, and certain blood pressure medications, especially ACE inhibitors and diuretics. For older adults with both high blood pressure and arthritis, this interaction often goes undetected, even though it can make arthritis symptoms worse and put extra strain on the kidneys and heart. NSAIDs are widely used to ease pain and lower inflammation in arthritis. They work by blocking the production of prostaglandins, chemicals in the body that cause swelling and joint sensitivity. While this can help in the short term, problems come up when NSAIDs are taken regularly with blood pressure medicines. Drugs like lisinopril, enalapril, or hydrochlorothiazide help the heart by changing how the body manages fluids and sodium. But when taken with NSAIDs, these drugs might not work as well. Worse, they can cause fluid buildup, more joint swelling, and higher blood pressure. This is exactly what happened to Leonard Len Chambers, a 79-year-old retired accountant from Louisville, Kentucky. Len had been using over-the-counter ibuprofen for mild osteoarthritis, especially in cold months when his knees stiffened. He was also prescribed a diuretic and an ACE inhibitor for his high blood pressure. At first, everything seemed fine until Len began waking with swollen ankles and a dull lower backache. He thought it was just aging or a new arthritis flare-up, but a routine checkup showed his kidney function had worsened. His doctor linked it to the regular use of NSAIDs alongside blood pressure meds, which had quietly interfered over time. After talking with his doctor and pharmacist, Len changed his pain management. He started trying non-drug options like turmeric supplements and gentle stretching, using NSAIDs only occasionally under medical advice. Within weeks, the swelling went down and his blood pressure became stable again. For others with similar conditions, Len's story is a strong example of how one health routine can unknowingly harm another. NSAIDs are not dangerous by themselves, but when combined with some heart medications, they can disrupt fluid balance and blood flow, making joint pain worse instead of better. That's why it's crucial for older adults to talk about all their medications, prescription and over-the-counter, with their doctors or pharmacists regularly, especially when treating joint pain and high blood pressure at once. Knowing about these interactions can be the difference between progress and setbacks. Often small changes like spacing out medications, choosing different pain relief methods, or switching to less reactive drugs can improve joint comfort and overall health. When managing joint pain, knowledge is not just power, it's protection, especially when the medicine meant to help could be quietly causing harm. Number 3, statins and muscle pain. Statins are widely prescribed to lower cholesterol and help prevent heart attacks and strokes. But for some people, especially older adults, they can also cause side effects that feel a lot like arthritis. This can lead to confusion about what's really going on. Statins like atorvastatin or simvastatin work by blocking an enzyme in the liver that helps make cholesterol. But this same process can lower levels of CoQ10, a substance your muscles need to function well. When CoQ10 drops, some people develop muscle pain, fatigue, or stiffness. These symptoms often get mistaken for arthritis or simply chalked up to aging. The risk increases when statins are combined with other medications that affect the liver, such as certain antibiotics, antifungals, or even grapefruit juice. These can interfere with how the body breaks down statins, leading to higher levels in the blood and stronger side effects. Warren Woody Ellis, a 76-year-old retired firefighter from Tampa, had been taking a statin for over 10 years without any problems, but then his doctor prescribed an antifungal for a skin infection. Within days, Woody started feeling stiff in his legs and lower back. At first, he assumed it was just his osteoarthritis acting up, but this discomfort felt different. His legs were weak, especially going upstairs, and he had trouble keeping his balance. Blood tests showed that the antifungal medication had interfered with how his body was processing the statin, causing elevated levels that were affecting his muscles. His doctor paused the statin, switched him to a different antifungal, and later restarted the statin at a lower dose. They also added a CoQ10 supplement. Within a week, Woody felt stronger and the stiffness eased up. This kind of situation is more common than people think. Muscle pain caused by statins doesn't always feel like joint pain, but the symptoms can overlap. That makes it easy to miss the real cause. If you're taking a statin and notice new pain, stiffness, or fatigue, especially after starting another medication, it's worth checking in with your doctor. A simple blood test can help spot muscle damage early. Managing arthritis or joint pain while taking other medications takes some attention. Each drug affects the body in different ways, and sometimes what feels like arthritis might be your body reacting to a drug interaction. Catching the signs early can help prevent long-term problems and keep your treatment plan on track. Number 4, diuretics and gout flares. Diuretics, commonly known as water pills, are often used by seniors to manage conditions like high blood pressure or heart failure. These medications help the body get rid of excess fluid and sodium through urination. This reduces pressure on the heart and helps control blood pressure. But while they're effective in supporting cardiovascular health, they can create problems for people with arthritis, especially gout. Gout is a type of arthritis that happens when uric acid builds up in the blood. This buildup can form sharp crystals in the joints, often affecting the big toe, ankle, knee, or fingers. The result is sudden and intense pain, redness, and swelling. Certain types of diuretics, especially thiazide and loop diuretics, make it harder for the kidneys to remove uric acid. This leads to higher uric acid levels in the blood and increases the risk of a gout attack. Darlene D. Kruger, an 84-year-old retired florist from Mobile, Alabama, experienced this firsthand. She had been taking a diuretic for years to manage her blood pressure. Then one day, she felt sharp pain in her left foot. At first, she thought it was a sprain, but the swelling got worse and the skin became red and hot. Her doctor diagnosed her with gout, a condition she had never dealt with before. It turned out that her diuretic was raising her uric acid levels. Her doctor changed her medication to one that didn't affect uric acid as much. Darlene also made changes to her diet, cutting back on purine-rich foods like red meat and shellfish, and started taking a low-dose medication to lower her uric acid. Since then, her symptoms have improved and she hasn't had another flare-up. This type of reaction is especially important to recognize in older adults. Gout can easily be mistaken for other types of arthritis. Many people may assume their osteoarthritis is simply getting worse when it could actually be a gout flare triggered by medication. That's why it's important to review medications regularly and report any new or unusual joint pain to your doctor. A simple blood test to check uric acid levels can help. In many cases, small changes to medication or diet are enough to manage the symptoms without completely changing the treatment plan. When dealing with multiple health issues, one medication can affect more than one system. But with regular monitoring and adjustments, it's possible to treat heart and joint issues without creating new problems in the process. Number 5, antidepressants and sleep aids. For many seniors, arthritis affects more than just the joints. It can also disrupt sleep and lower mood. To help manage this, doctors sometimes prescribe antidepressants or sleep aids. These medications can improve rest and emotional well-being, but they also come with side effects that can make arthritis harder to manage. Some antidepressants, especially selective serotonin reuptake inhibitors, SSRIs, and certain sleep medications like zolpidem or trazodone can cause joint stiffness, muscle discomfort, or restlessness. When used alongside arthritis medications like corticosteroids or NSAIDs, the sedating effects can sometimes hide the signs of a flare-up. This delay can lead to worse inflammation before it's noticed. These drugs can also affect how the liver breaks down other medications, which might lower the effectiveness of arthritis treatments or cause them to build up in the body. Stanley Holbrook, a 77-year-old retired pharmacist from Syracuse, New York, learned this the hard way. After being diagnosed with early-stage inflammatory arthritis, his doctor gave him a low-dose antidepressant to help him sleep. At first, he was glad to get better rest, but over time he began waking up with stiffness in his shoulders and knees that lasted well into the day. He also felt like his pain meds weren't working as well, and he couldn't clearly feel where the pain was coming from. After going over his medications with his rheumatologist, they realized the antidepressant was dulling his ability to notice pain and was interfering with how his body processed his arthritis medication. After switching to non-drug sleep strategies like mindfulness, a weighted blanket, and melatonin, Stanley was able to feel his symptoms more clearly and respond to them better. This kind of issue isn't always dramatic, it's often subtle. Recognizing when arthritis is flaring up is important for preventing long-term joint damage. If a medication dulls your senses or interferes with your other treatments, it can make it harder to manage the condition effectively. That's why it's important to work with doctors who consider both mental and physical health, especially for older adults. If you're taking medications for sleep or anxiety along with arthritis treatments, it's worth having a conversation about how these drugs may be affecting your overall care. The goal isn't just better sleep, it's better awareness and more control over your health every day. Number 6, herbal supplements and prescription medications. A growing number of older adults are turning to herbal remedies and supplements to help manage inflammation, improve energy, or support their immune system. Many of these products can offer some benefits, but they also carry risks, especially when taken alongside prescription medications for arthritis or other chronic conditions. One of the most overlooked causes of drug interactions comes not from a prescription bottle, but from the supplement shelf. Products like turmeric, ginseng, garlic extract, St. John's wort, and fish oil are often promoted as natural anti-inflammatories. That might sound helpful for someone dealing with joint pain, but the situation isn't that simple. These supplements can change how the liver processes medications. In some cases, they may speed up the breakdown of arthritis drugs, making them less effective. In other cases, they can raise the drug levels in your bloodstream, which increases the risk of side effects such as stomach discomfort, dizziness, or strain on the liver. Some supplements also thin the blood, raising the risk of bruising or internal bleeding, especially when combined with NSAIDs or corticosteroids. Clay Weston, a 73-year-old retired school principal from San Diego, learned this the hard way. After being diagnosed with psoriatic arthritis, he started taking low-dose immunosuppressants. Hoping to avoid additional prescriptions, he added turmeric and garlic extract to his routine after reading about their anti-inflammatory benefits. At first, he felt slightly better, but a few months later, he began feeling unusually tired, dizzy, and had ongoing indigestion. Blood tests showed elevated liver enzymes and inconsistent drug levels. After a review with his doctor and pharmacist, they realized the supplements were interfering with how his liver processed the medication. Once he stopped the supplements and returned to his original plan, with closer monitoring, his symptoms improved and his energy returned. Clay's story is not rare. Many people assume that if something is natural, it must be harmless. But natural supplements can still cause side effects and interact with medications. Even everyday nutrients like vitamin E or large doses of fish oil can thin the blood or affect how drugs are absorbed and processed. This doesn't mean supplements must be avoided completely, but they should be used with care. Before adding any new vitamin, herb, or over-the-counter product, speak with your doctor or pharmacist. Ask about possible interactions with your current medications, how they might affect your liver or kidneys, and what dosage is safe for you. When it comes to joint health, it's not only about what you take, it's about how everything works together. Even well-intentioned choices can backfire if they aren't part of a clear, informed plan. Managing arthritis means managing the whole system, and that means making decisions based on knowledge, not just labels. Living with arthritis is already challenging, but what makes it harder are the small, unnoticed drug interactions that work against your progress. From NSAIDs and blood pressure meds to antidepressants, statins, and herbal products, these combinations can quietly worsen your symptoms over time. The signs are easy to miss: a little more stiffness, unusual fatigue, or a dull ache in a new spot. But over weeks or months, these small changes can disrupt your pain management plan and reduce your quality of life. Awareness is your best tool. Every product you take, prescription, over-the-counter, or natural, can influence your arthritis. This isn't about fear, it's about being informed and staying involved in your care. If you're taking several medications and notice changes in your joints, talk to your doctor. Ask for a full review of everything you're using, not just for safety, but to make sure it all works well together. Sometimes a simple tweak in timing or dosage can make a big difference. And if your body feels different, even in a small way, pay attention. Let your doctor know. Every small step toward understanding your treatment is a step toward better movement, comfort, and independence. If this video helped explain something you've been wondering about, let us know in the comments. Don't forget to like, share, and subscribe to our channel.